Okay, everyone. So welcome to our May DCo Talks. In about a minute, it'll be 12:30. So we're just gonna start in a little while, just give people time to come in. Okay, so welcome to our May DCo Talks, Women's Health, Why Maternal Health Matters. So I want to introduce myself. I'm Alicia Watson, one of the facilitators of DCo Talks. I work in the Public Information Office as a public information specialist, and I also want to introduce Dawn Dudley. She's a senior public information specialist in the Public Information Office, and she's also my co-facilitator for this program. So I don't know if you guys have attended a DCo Talks session before, but DCo Talks is an employee-led program designed to foster connection, conversation, and community among Durham County Government employees. Sessions provide a welcoming space for employees to share experiences, exchange ideas, and engage in meaningful discussions. So just to keep you housekeeping notes, this session is being recorded. We record the sessions to share with other employees who might not have been able to make it. Please mute your microphone. This is going to be an engaging session. There will be moments where our presenter Eboni may prompt you to speak or write in the chat, but be courteous. Post your questions for the speaker in the chat, and me or Dawn will make sure Eboni answers your question before the end of the session. So to introduce our speaker for today, Eboni Quick is the Women's Health Navigator for Durham County Public Health. And her bio is on the screen, and I'm going to give a few highlights from her bio. Eboni is a registered nurse with nearly 14 years of experience in maternal fetal medicine, women's health, and high-risk patient care. She holds a Bachelor's of Science in Nursing from North Carolina Central, and also a Bachelor's of Science in Human Sciences from North Carolina Central University as well. She is currently pursuing her MSN as a psychiatric mental health nurse practitioner at Cleveland State University with the expected completion date of 2026. She has been recognized with several prestigious awards, including a NACO 2024 Achievement Award for addressing maternal health disparities, the Daisy Award for Extraordinary Nurse at UNC Hospital, and Women's Services Employee of the Month at UNC Women's Hospital. She is a certified neonatal resuscitation advanced fetal monitoring. She is certified in neonatal resuscitation, advanced fetal monitoring, youth mental health first aid, and holds an active nursing licensure in North Carolina. She is an active professional who participates in committees and professional organizations such as the American Nurses Association, North Carolina Nurses Association, Postpartum Support International, and is a recipient of the NC Matters Maternal Health Fellowship. Her commitment to improving maternal health outcomes is demonstrated through her current role as Women's Health Nurse Navigator at Durham County Department of Public Health, where she integrates community engagement and evidence-based care. So I am going to turn it over to our speaker, Eboni Quick. So I'm going to stop sharing my screen, Eboni, and let you take over.
Okay. Hello, everyone. Thank you for the introduction. That sounds so great. I just feel like I need to take you around with me and just introduce me all the time. That was awesome. So thanks everyone for joining me today. I'm so excited that you are here, and I'm going to start sharing my screen. So today, why are we here? So today we're talking about women, supporting women through every step, preconception through postpartum. And I know sometimes when we think of women's health, we kind of think of pregnancy, but there is a little bit more to the continuum. So that's some things we're going to discuss today. And again, she's already kind of told you who I am, but some things I do here. I'm in the Department of Public Health and Women's Services. So I do a lot of coordination of care and education with patients. Of course, serving the diverse community in Durham County. I provide direct care, supporting patients through pregnancy, through postpartum. Lots of community outreach to reduce maternity mortality and morbidity, kind of meeting patients where they are within the Durham community. And also I engage with lots of local organizations to raise awareness. I'm the person that's always raising my hand. It's like, oh, I want to join that because I just like to be involved and abreast things that are going on in the maternal health field. So next, so I've already kind of discussed our purpose, and we will get more in depth to what each of these actually means. So preconception, pregnancy, and postpartum. So that's the purpose of the discussion today. And I just want to give a disclaimer. So this presentation is intended for informational and educational purposes only. It is not intended to provide medical advice, diagnosis, or treatment. Please consult a qualified healthcare professional or provider for any questions or concerns regarding your personal health or medical conditions. And the content shared reflects my personal experience and current role as a women's health nurse navigator and does not necessarily represent the views of any affiliated institutions. Now that we got that out the way, and I can't see the chat, so some people can kind of come off mute. So kind of want to do an icebreaker because I know a lot of us are here today. So before we get into the main icebreaker, know that it's kind of like cold and rainy outside. If two people can come off mute, if you could be anywhere else besides the cold and the rain, what would your ideal place be? Anyone? Or I'll
Maui.
start calling people. What did you say?
Maui.
Oh, okay. Love that.
Dubai.
Anybody?
Dubai.
I want to go to
Belize.
Dubai. Oh, take me with you. Y'all got money. Take me with you. And one more icebreaker. I have to shout out. How many eagles do we have here? Lots. Anybody Eagle Pride?
What kind of
Oh.
eagle?
Eagle Pride?
Eagle
kind of
Pride,
eagle?
amplified. So you can rep your school in the chat. I just had to shout out my HBCU. So icebreaker. So I'll say a few words related to pregnancy or postpartum health, and I want you to kind of shout out the first thing that comes to mind. For example, if I gave the word pregnancy, someone can put it in the chat or say the first thing you think of, and I might say, the first thing I think of is baby. Does that make sense? I'll do just a few. So let's see, postpartum. What's the first thing that comes to mind? Anybody? If your last name starts with the letter S. Emotional. I love that. And I can't see the chat, so that's why I'm kind of talking over. Okay, I love that. And there are some things that we are definitely going to talk about today. How about baby?
Scary.
No
Right.
swim.
We see
Cute.
cute, bills, joy.
Okay. Okay. So all of these things we are going to talk about, okay? So I wanted to start off with kind of like a health hurdle. And this is going to be very engaging. I'm not just going to sit here and talk to you. So I want you guys to talk back to me. I know you're probably eating your lunch, so you can't come off camera, but I do want us to be very engaging because this is a very important topic. So one person, name one challenge you've seen or experienced that affects maternal or women's health. That can be with a family member, that can be with your patients, the community.
Healthcare.
And when you say healthcare, do you mean access to healthcare or healthcare structure?
Access to healthcare. Understanding your healthcare. being able to advocate for yourself and your health care.
Have you seen my slides? 'Cause I'm sorry.
No.
You're hitting on some interesting points that we were getting to. Next, what's something important you would tell a new or expected mother or parent about preconception, pregnancy, or the postpartum period? One person.
Accept help.
I love that. Yes, accept help. And all of these things kind of tie into that emotional and that support. So we're going to kind of get into it now. So the continuum of care, what is that? So preconception, prenatal, postpartum, and family planning. So starting with a maternal health continuum of preconception, that is the health before pregnancy, which we will get into. Pregnancy, that's just monitoring and care during pregnancy. And postpartum is support and recovery after birth. So preconception health, the importance of planning and wellness before pregnancy, chronic conditions, and these are just a few: diabetes, hypertension, nutrition, substance use, mental health. So what that actually looks like for those that are planning to get pregnant, or even if you're not, preconception health is very important because there are a lot of patients or mothers that have pre-existing conditions or comorbidities that they may not be aware of, or they may be aware of that they really need to manage before getting pregnant, because some of these issues can actually contribute to these high mortality rates and complications during pregnancy, after pregnancy. For example, if someone has hypertension and they're not taking medication, or their blood pressures are not under control, when they get pregnant, pregnancy is already stress on your body, so it's only going to get worse. So preconception health is a really good chance, or not chance, but a really good time to monitor those health conditions and get support and to get medical attention before you try to get pregnant or become pregnant, just because these things will need to be treated before pregnancy, just to have, because we're trying to promote optimal well-being and outcomes. So pregnancy health, regular prenatal care, monitoring high-risk conditions, and importance of emotional support in safe environments. So the first bullet, regular prenatal health. So we don't just want patients just to come, you get your checkup. Regular prenatal health is very important. Make sure they're coming to all of those visits, because as the body and the baby grows, there are different things that happen during the pregnancy, different types of monitoring, medications, immunization. So we definitely want patients to get that regular prenatal care. And then that's also a chance to monitor high-risk conditions. And we'll kind of get into that later and tying into the maternal health clinic, what we do here. But it's very important because it also is a chance to assess those emotional and those needs and those barriers. Now, postpartum health is so essential. This is a chance when providers can check the post-birth physical and mental health checks and support breastfeeding and recovery, and addressing postpartum depression and anxiety. We want to make sure that this part, that patients actually come back, because some patients feel that after they have the baby, they don't necessarily need to come back. But there is evidence that the postpartum period, things can, you can have complications up to a year, and we'll kind of get into that as well. So in the continuum of care, this is the need for ongoing support, not just during pregnancy. Now, why maternal health matters. And I've already kind of talked about some of these things, but that direct patient care, and I can kind of tie in my role as a nurse navigator, what I see, and why I feel that it's important. But of course, due to HIPAA, no patient information, no cases will be shared. So direct patient care, that's a chance for you to meet with patients. You can build trust, continuity, and it's also a chance to identify any complications they may have. But the importance with identification of those complications is to act on it promptly, because you want to reduce any type of mortality and complications. So not only identifying, but to act on those complications early versus later. Close monitoring of at-risk patients and the need for ongoing assessments, and we'll talk about a little bit later, or the need to refer out if it's beyond your scope. But this is a chance to individualize those care plans. So like, for instance, like I was talking about hypertension, if someone had hypertension in their past, that would take some close monitoring just to make sure they're not exhibiting any signs of hypertension that can affect them or the baby. And then at that point, of course, you cater individualized care plans and things of that nature. Education, awareness. If I can make this really big, it would be huge, because I feel like this is the meat of enhancing healthcare literacy and getting women and birthing individuals to actually advocate for themselves and just to be aware, bringing awareness to what is a complication, what does this look like, what should I do? So just empowering them with knowledge. So education and awareness is very, very important. So collaboration and referrals, that kind of goes back to all of these kind of tying together. But that goes back to the ongoing assessments. And let's say if a patient, we're going to stick with hypertension, her hypertension it seems like it can't be managed at a low level, then that's the need to collaborate with a high-risk clinic, do some referrals, if it's something with mental health, or even other entities we have in the health department if they need other support. So collaboration and referrals is also a big piece of this. And commitment to health equity. I think that we do a really good job here addressing systemic barriers, but this is so key. And then also promoting culturally competent care. And we all know that we have wonderful, wonderful, wonderful interpreters here. So just being mindful that all of these things, they kind of go together. And this is why mental health matters, because when we do these things, we are providing that cultural consummate care, and we're putting everything together. Moving on. So I am here in the maternal health clinic with women's services, and I cannot brag enough. I will review some of these, but we do so much here. The care here is top tier. It is wonderful care. Our patients, they get so much information, but this is how we are helping to bridge the gap in maternal health. So the maternity clinic, they provide, of course, antepartum care. They get routine prenatal visits. We do some postpartum care depending on the route of birth and the birth control. Fetal monitoring, non-stress tests. They can monitor the baby here if, let's say, a mom says she hasn't felt her baby move, or they could be past 40 weeks. They do have that capability to do that here. And prenatal labs, they can add those as needed. And we do have a new lactation services here who was just hired. Shout out to Mara. And the centering program, which is also in the maternal health clinic. This is a evidence-based program, and what it is group prenatal care. And this is a really wonderful program embedded in maternal health. Because and I've been in these sessions, the mothers, they're in a group of women, and they are grouped together by their gestational age, meaning when they deliver. So they get wonderful information. They have all of their visits ahead of time. So for some moms that may experience some problems like getting off of work or scheduling, she has her schedule for the rest of her pregnancy. And they have the same midwife or provider throughout those sessions. So within these sessions, they're able to build like a lot of rapport. They really get close to each other. A lot of them after they have the baby. Uh-oh. Hello. Okay. So a lot of the moms after they deliver, they continue to have to be friends. And it's just wonderful for those moms who really need that support. And like I said, it is evidence-based program. And I do have the website information on the reference if you want to look that up. But there's all kind of evidence that these women are more prepared for birth and all the information they receive. So if you ever get a chance to look at that website, we do offer that here. And it is a wonderful, wonderful program. In the SIMHEART program, that is our case management of high-risk pregnancies that's embedded here in the maternal health clinic as well. And these are a group of case managers, some are nurses, some are social workers, and they provide high-risk assessments for pregnant patients. The pregnant patients do like a screening, and then based off that screening, they meet a certain criteria, and then they are assigned to a caseworker. And the thing about this program, makes it so unique is that it's not just Durham Health Department patients. They actually are in connection with OBGYN, and all over Durham County. So they have multiple patients all over, and they do such a wonderful job. I've seen them work with the patients here, just giving them that extra support that they need, and lots of information. And then they also will follow them after they deliver the baby up to 8 weeks. So it is also a wonderful program that we have here. That's another way that we're bridging the gap in women's health services. Now, family planning clinic, the list could be even longer. They do so much wonderful things at a family planning clinic. Patients, sometimes they start their journey in family planning because they'll take a pregnancy test, and at that point they get counseling. And then they transition to the maternal health clinic. But they do all types of birth control, IUDs, implants, pills, injectables, different things, sponges, even more. But it's not just for women that want birth control. They also do screenings and assessments for those who are just wanting to stay in tune with their health with annual exams, but not necessarily just birth control. Vasectomy information for partners. We have a nurse here that helps them do the application and refer out. So there's funding for that. And of course, they do the post-delivery assessments with the postpartum, the family planning counseling, and the additional screenings. And they do something what we call quick start nurse visits for our postpartum patients. If they want birth control prior to their postpartum appointment, which could be, of course, 6 to 8 weeks out, if someone wants to come in a week after delivery to get something that we call a bridge to birth control, if they're going to get something that's a little bit longer, like a IUD or an implant, some mothers, they may want to get a bridge, so they have a nurse visit, and that kind of helps with the short interval pregnancies, which we know that is also a goal with that. And then the BSAP program, breast and cervical cancer control program, there is funding for uninsured and underinsured women to assist with mammograms and breast cancer screening and cervical screening. Of course, we can do the cervical screening here with PAPS, but the breast cancer screening we refer out. And this is not just for young women, women that are older in age, let's say 60 and above, they can also get the services here. So they offer a range of services from preconception to, let's say, 60s, 70s. It just depends on the screening. So it's not just limited to younger. So how does this all help bridge the gap? So we want to provide comprehensive, culturally competent care, collaborate, educate, and empower patients across the reproductive system. So not just during pregnancy, but across that reproductive system. So that's what we do here and a lot more. It is wonderful. The services that the patients receive here is wonderful. So I want to share a video, and then we're going to do some reflection. So this is from the CDC Hear Her campaign, which is a platform used to empower women to speak up. So this is Joanna's story, and I'm just going to play her part one. And then we will come back to reflect and talk about it. Oh, let's start over, Joanna. There we go.
No, we cannot hear the sound. So you might have to reshare and click
You
the
can't
function
hear?
to share with sound. Yeah, no, we can't hear.
Okay, so I need to stop and start again.
Yeah.
Okay,
I'll
and
share
go back to
using
that
sound.
screen. Okay. One second. Let's share again. Wonder if I could
And
just
share with sound should be at the top once you click share.
Okay, let's go back. Share. Wait, I'm sorry. Pause that. Okay, give me 1 second. We coming. Include sound. Share. Okay, let's go back to Joanna. We'll get there. Okay, let me know if you can hear it. I have to
Yes, that's
start it
good.
over.
Thank you.
Okay, let's restart Joanna. Here we go, Joanna.
Hi, I'm Joanna. I'm from Queens, New York, and I have 2 daughters. After I gave birth to my first daughter, I thought everything was fine. During the actual delivery, my blood pressure was going up. 2 days later, I started to feel sick, like my head was hurting. I started getting extremely swollen, like in my legs and in my hands, and that never happened to me throughout my pregnancy. I remember I went to sleep, and then the next morning I still wasn't feeling well. My head was hurting, I was feeling dizzy, I just wasn't feeling well at all. And then I took my blood pressure and it was really high, and then I was just like, something's wrong. And I went to the hospital. I went to the emergency room. Once I got to the emergency room, they admitted me right away. I had no idea what was going on. And they said if I would have stayed home any longer, that it was possible that I could have had a stroke, or I could have possibly even had a seizure or died at home. I was also diagnosed with postpartum preeclampsia. I didn't know that that was a thing. I thought preeclampsia only happened during pregnancy. You know your body. If something doesn't feel right, speak up and get the care that you need.
Okay, so that's Joanna's story. Are there any takeaways from that video? 1 or 2 people.
Trust what
Listen
your
to your
body is
body.
saying.
Y'all are in sync. You were reading each other's mind. Okay, I heard trust and listen to your body. Anything else?
Advocate for yourself.
Perfect.
Yep.
Okay, so the role of health literacy. So some takeaways that I got from the video, Joanna, she didn't know what was going on. She just knew that something was wrong with her body. So that's number 1. That is key. Listen to your body. But also, this is a teachable moment because she wasn't aware what any of that meant. Had she come to the Durham County Health Department and saw us, she would have known, because I would have given her this handout, which is the importance of health literacy. So understanding symptoms and when to seek help, knowing patients' rights and navigating care systems, and empowering informed decisions. So this sheet here, I was speaking of the CDC Hear Her campaign earlier, and it is a wonderful platform that we use here in our clinic across postpartum and maternal, just of signs and symptoms that can occur in pregnancy. Now, can anyone read that top line for me? Where it says pregnant now. I'm gonna call somebody.
Pregnant now or within the last year, get medical
Perfect.
care right away if you experience any of the following symptoms.
Is that Lakita? Hey, Lakita.
It is. Hi,
Hey.
Ebony.
Hi. So what this is pregnant now or within the last year. Complications can occur up to a year. It's not just 6 weeks, 8 weeks after you have your postpartum visit, oh, I'm fine. No, complications can occur within the last year. And if you know people that had a baby recently or family members, I always make sure that we advocate for the patients and tell them if you have to seek care, make sure you tell them that you have delivered within the last year because it changes the whole plan of care. So this list, one more person, I love interaction. Is there anything on this list that Joanna experienced? Anyone?
I think she
Extreme
said something
swelling
about
of
headaches
Mm-hmm. Headache.
and shortness of breath, I thought.
Mm-hmm. I think she said shortness of breath. Mm-hmm. And she also had some swelling. So these
Yeah.
are things with preeclampsia. If you go back to the hypertension, if we go back to the continuum, someone who had hypertension before they got pregnant and they had complications during pregnancy, because you have chronic hypertension and preeclampsia, won't really get too much into that. But some of these conditions, you see how it can continue from preconception to when she was pregnant to now postpartum. So that's a whole continuum of pregnancy, a continuum of care when you think about something of hypertension. So that's what that could look like. Okay, let's move on. So maternal health goals, these are just a few. Bridge to care, improve birth outcomes, comprehensive support, culturally competent care, helping patients overcome barriers, optimize health before pregnancy, reduce maternal morbidity, and enhance self-care techniques. So these are all of the goals, some of the goals that we want to accomplish with the continuum of care through preconception to postpartum. So this is something that I created here in conjunction with Breastfeed Durham, and their information is at the bottom. So this is a timeline of pregnancy and resources that we have here at the Durham County Health Department and Public Health. So for patients, sometimes pregnancy, they can be a little nervous, not sure what to expect next. So we created a timeline just so they can see things to expect within their pregnancy and things that will happen. So for instance, if they're going to get labs on a certain visit, or when should they expect to get different exams. So this is kind of a guide they can have so they can be informed, because we want to keep our patients informed. Then also perinatal resources. So these are things that they can scan the barcode, and we do have English and Spanish. We have a lot of cards here that we give to patients here, but it has wonderful information about mental health. If they want to order a pump, it has information about WIC and prenatal education, and then some postpartum support, and then those warning signs at the bottom that we refer to in the 4th trimester. Now these cards are a little bit smaller, but on the front is the timeline, in the back is the resources. So it's almost kind of like an insert they can kind of put in their book, or I tell some patients if you want to post it on your refrigerator, just something they can have handy if they have questions. And It's wonderful information we have here. I like colors, so of course I added some colors. So this is something really useful. Another thing with empowering patients with education and knowledge that we do here as well. Now, how can you help? How can you help? I've talked about knowledge and sharing so much, but it's more than just sharing that knowledge, it's acting on that knowledge. So you, as caregivers, as support, you can educate yourself and others. So the CDC, that website also has tips for providers, it has tips for patients, and for those support. So if a mom and her support person comes with her to the visit, I also give the support person information as well, so they can be aware of those signs and symptoms and when to the need to further have the patient or their partner to call and say, hey, I think you need to get this checked out. Advocate for policy and healthcare improvements. I know that's a different level, but that's also some ways that you can get involved. Be a maternal health champion. All that means is just showing up, giving support. Now, if it's tips and advice, if you don't really know what to advise, just say, hey, I think you need to call the triage nurse, call and speak with someone. Your main thing is just really being that support and pay attention, pay attention, pay attention. Look for those signs, because some moms or some patients, they may not speak up. But if you are aware of some of those signs, you can also speak up and just say, hey, I think you weren't looking like this yesterday. You're looking a little different today. Are you okay? And just start that conversation. Because patients, when they're comfortable, a lot of times they will speak to that person that they're closest to. So everyone has a role in this continuum. Small actions and big actions. Everyone has a role. Everyone can do their part. Isn't he cute? Announcement. So we do encourage and promote breastfeeding here. So we have 2 wonderful spaces. The first one is the pod near the registration. So it is wonderful. Moms can go in there and they can be comfortable. They can nurse their babies. It has a little message up here that I thought was cute. I actually went down there. It was so comfortable. The top of it has it's like a see-through, and then it gets dim. Yeah, definitely could take a nap, but I'm not because I'm at work, but it's very, very nice. Then upstairs in our clinic, we also have a lactation space, and this was created with Breastfeed Durham. And we're here 8 to 5 o'clock, and it's in Clinic 22. So this is for patients. It is for staff. It's very comfortable. It has like a little stool in the rocking chair. And if you wanted to use it, you would just come to the front at Clinic 22 and just sign a list, and you're welcome at it. It does have a sign on it. So for privacy, you could just slide it to that is in use, and it is a nice space. So that's attention. He wanted to let you guys know that. Community outreach. I love to be out in these streets, doing community work, meeting with community partners. And these are just a few. Some I can't list because I did not get permission to use the pictures. But I am a part of Bull City Strong, that they do a lot of education, and they have different cohorts about community. And some of these are events with different partners in the community. While I give education just about urgent maternal warning signs, things we do here at the health department. And I love to go out. I'm always raising my hand. I'm like, oh, I want to go, because I just think it's wonderful to meet patients where they are. So you expand your access to underserved populations who may not be aware of services, or even those warning signs, reduce stigma around maternal mental health and health disparities by giving them that knowledge. And you also can build trust and visibility within the community informs and empower individuals to seek timely care. And during these community events, people are really engaged. And you will meet so many people that say, oh, well, my friend just had a baby, or, oh, I didn't know that. And I say, you should have came to the health department because we give wonderful information. So I do meet a lot of moms who were not aware of certain things, which is why here at the health department, we like to keep our patients really informed. And of course, we want to share that knowledge with the Durham community. So as the Women's Health Nurse Navigator, I'm dedicated to monitoring and supporting obstetric patients, bridging gaps between clinic and community, educating and empowering patients, advocating for mental health equity. And my favorite quote from Maya Angelou, which I actually keep on my screensaver for the past 3 years, I've learned that people will forget what you said, people will forget what you did, but they will never forget how you made them feel, which is so important when you're interacting with women across the spectrum from preconception to postpartum, because it is a journey and everyone's journey is different. So just making them feel important, that they're seen. And I always make sure that I tell a mom or a pregnant mom, a newly delivered mom, you are doing the best that you can do and you are doing great. And after delivery, I said, you did that. You birthed a human. And I just want to applaud and praise them where they are, because mentally, it can be a struggle. And that's my other love, mental health. But just being there, letting these patients know across the continuum that we see you and you matter. So in summary, I did a who, what, when, where, and how. So who? Women and families. What? Why maternal health matters. When? Preconception to postpartum. Where? Here at the health department, in the community, and pretty much everywhere. And how? Listen, advocate, educate. And these are my references, and we will do some Q&A, and feel free to share your experiences and your thoughts and ideas. And that concludes, unless we have Q&A. Thank you. And this is my contact information. I'm sorry. This is my contact information. I am here in Clinic 22. I sit between maternal health and family planning. If you have upcoming events, I will raise my hand because I would like to be there and just connect and see how we can help our community with women's health and create some really good outcomes. So I will stop sharing now if that's okay.
No problem. Thank you so much, Ebony. You gave a wonderful presentation, and I love how our participants today were very engaged. We do have someone who's raised their hand, but before they ask their question, I do want to address a question regarding the CMHRP program, or maybe the Centering Parental Care program. Someone asked about the website for that program, and if you could share that information. Tamika, if that's not the appropriate question, please feel free to step forward and ask her the question you were trying to get to.
I think a young lady, Monica Johnson, had said that it was for the Centering Prenatal Care. It was a website that she had mentioned, and I was trying to get clarification and share that information.
Is it the Centering website you wanted?
I think so.
Okay, Centering Pregnancy, the group prenatal care?
Yes.
Okay, I can drop that in the chat.
Thank you,
we,
Tamika.
like I said, we offer it here. So if you have, patients or people in the Durham community, it is a wonderful program, and I really, I recommend. Let's see here. I am dropping that in the chat.
Awesome. Thank you, Ebony. Lakita, if you want to come off mute and ask your question.
Sure. Hi again, Ebony.
Hi,
Your
Lakita.
presentation was amazing, and I can attest to the fact that Ebony is everywhere and she does a wonderful job. We're lucky to have her. Ebony, do you mind if I highlight some of the work we do in Health Ed to support? our
Yes,
families on the
please
continuum?
do.
Okay, hopefully I don't forget anything. But as far as preconception health, I know we have a preconception health program. Actually, we launched it at Central. Brienne runs it, so she has students who conducts different educational programming on Central's campus to teach people about preconception health, and they get trained and they come up with different engaging topics. We feed students and we just make sure that they are prepared to be ambassadors and have what they need, and also, you know, provide whatever support is necessary so they can offer different programs on campus. For our pregnant families, we offer childbirth classes, and for our postpartum families, well, oh, and we also offer breastfeeding education. For our postpartum families, we have a program called Mothers and Babies. Ebony, I think you're trained on that too, which is for pregnant people, pregnant women, and people who just given birth. And basically, it is a postpartum slash stress management program. All of the services that we offer are free, and so we love working with Women's Health to support all of our lovely families here in Durham County.
And
That's
Lakita
it.
does a really, really good job. And we have to connect soon because I have some stuff. But yeah.
Sounds
Thank you,
good. Thank
Lakita.
you.
Thank you, Lakita. Lakita, could you drop some of those links that you referred to, if there are links, or any flyers that would help inform this group further on some of the things that you highlighted that support some of the work that Ebony mentioned in her presentations? So if there's anything connected, please do share. And Ebony, thank you for dropping
Okay,
links.
thank you.
Thank you, Lakita. Thank you, Ebony, for dropping links. If there are any other employees here that work in programs that support this subject matter, feel free to share your information as well. We are a community, and the more informed we are, the better we are in servicing the people that we support. Public service is our business, as I say. So there may be some crossover areas. Please feel free to share. Are there any other questions from our group that you would like to ask Ebony? Feel free to drop them in the chat or come off of mute and ask. Well, seeing none at this time, I just want to make sure I extend gratitude and appreciation to Ebony for joining us today for today's DCo Talks discussion. We really enjoyed the information that you shared, and hoping that the information shared will be shared with others. There are a lot of us that have known pregnant people or been pregnant ourselves or thinking about it. And so this information is applicable to us all. So thank you, Ebony. Do you have any final comments? I know you shared your contact information. Feel free to copy and paste that in the chat as well.
No, one more thing. I am also a part of the mental health committee for Partnership of Healthy Durham, and there is an event coming up this weekend for mental health. I will drop it in the chat. It is free and open to the public. So I will attach that. It's a mental health wellness day, and it's from 10 to 12. So I will drop that or share that, and you can register, or you don't have to register. You can just come out. It's food and it's just mental health awareness. So I will drop that, and that's it. And I will put my information in the chat as well.
Great. Thank you, Ebony. Thank you, Ebony. Okay, well, this will come to the conclusion of Ebony's part of the presentation. Just want to share some quick information with everyone about DCo Talks. We do have monthly sessions, and we cover a myriad of topics. We would love to hear from you, and I'll share our survey link soon, but wanted to bring your attention to our My DCo page. Is under the news section for public information. If you look there, you'll see announcements for future sessions, and also you will be able to see past sessions and any links to recordings or flyers that we have. So feel free to visit that page and share with others. We have covered some very interesting topics over the years since DCo Talks was launched. Also, going back to the conversation or what I just highlighted about surveys, um, surveys are really important for us to be able to gauge what's next or what will keep us engaged and give our audience, our target audience, information that they're seeking. I just dropped a link to the survey for today's DCo Talk session. Feel free to complete that, sharing your feedback regarding today's session or information about topics you would like to cover in the future. Our June session will be announced soon, so be on the lookout for that information. We hope that you will join us again. This chat will continue here, so if you have any other information that you want to share after we discontinue today's meeting, feel free to do so. Again, from the public information team, myself and Alicia Watson, we want to thank Eboni, Public Health. We saw some of the director on and other leadership from Public Health here. Thank you for your support of Eboni today. It takes a whole village for us to do this here, and I just love that we have information that we can share with each other and empower one another. I hope that everyone has a wonderful Wednesday. I would love to be somewhere else too. I didn't share where I would like to be, but definitely somewhere tropical. I hope that maybe some of you all can go there, or at least in your mind.
Yes.
All right. Well, everyone, have a wonderful day, and thank you again, Eboni.
Thank you,
Bye-bye,
everyone.
everyone.
Enjoy your day. Bye-bye.